Hey, welcome back to Helpless 95. In video 2 of our TacMed series, we're going to be talking about phases of care. Thanks for joining us. All right, in the TacMed world, or TCCC, Tactical Combat Casualty Care, there are three basic phases of care that we're going to use to break down kind of what we're thinking about and how we're going to be treating people. First is care under fire. Second is tactical field care. And the third is the evacuation phase. All right, the first phase of care that we talked about is care under fire. Pretty self-explanatory. You're getting shot at, or something bad's happening to you. The hurting is still going on. And that's your biggest priority here. It's not trying to take care of the casualty right away. It's trying to stop whatever's hurting something. This could be applied in a normal civilian context to somebody got ran over in the middle of the highway. You're going to want to get the vehicle stopped before you go run out in the middle of this highway to work on them. Otherwise, you're going to get hit too. Same thing in a gunfight. You need to stop the bullets from flying. That way, everybody stays safe. So winning the fight's the most important thing. There's a lot of science that goes into this. It's for your survivability of the person who's hurt as well as everybody else. We'll break that down a little bit later. The concept of getting off the X is wherever you got hurt at. If you got hurt there once, you get hurt there again. Somebody shot you in the spot one time, they could do it again. Somebody ran you over with a semi, they could run you over in that same spot again. So get away from that spot that's dangerous. Your care at this point is very limited to pretty much yourself or your buddy that's sitting right next to you. You're not going to probably have a corpsman, team medic, somebody like that going to show up and provide care because they're too busy doing other stuff like making the place safe. And it's really the care and the tools you have is limited to what you've got immediately accessible on your person. If it's in your backpack, you probably won't have time to grab it out, and you're really only worried about the immediate life threats that are super time sensitive, which are going to be bleeding to the extremities and possibly airway issues. Okay, our second phase of care is called the tactical field care phase. This is when the fight is stopped. You've got the person off the side of the highway and they're not in the direct line of getting hurt again. Remember that you have to be aware of what's going on around you because danger is still close by, and it could always go back to that being your number one priority of having to maintain safety for everybody around you. At this point, you're going to have enough time to do a full March assessment, and that is the algorithm that the tactical medicine utilizes for patient care. We'll be going over that here soon. Hopefully at this point, you're going to have the medical guy on the team is going to be able to provide care. It still could be you, depending on what's going on. That person could be pretty busy if there's a lot of casualties. But hopefully your more medically qualified people at this point are going to start taking over the care in the field. If you don't have that available, though, that's where you're going to step in, and that's where you're going to start working through that March algorithm. Your equipment's still very limited. At this point, though, you can probably break out what you have in your backpack and then utilize first what equipment that casualty is carrying as opposed to using your stuff. Okay, your third and final phase is the evacuation. This is where you have a little bit more time, hopefully. Best to make a plan for the exact movement that you're going to be doing to get that person to a place where you can pass them off to somebody who's going to provide them definitive care. Usually, this tactical medicine isn't built for people who are going to be providing long-term care. So this is how are we going to get this person to the hospital, shock trauma platoon, evac out to somebody in a rear area. What resources do you have available? Something you got to think about. Can you call for some help? Can you get a bird, ambulance, somebody else that can carry him, Sherpa, something like that? Again, you're still dealing with a very limited amount of resources. Whatever you guys brought there is what you've got until somebody else shows up. This is usually either one of the quickest parts of doing tactical medicine. Either you're going to have somebody show up right away and take that casualty off your hands, or it'll be the longest. You've got a long evac time until you can do a turnover. So that it could go either way. I think it's one of the more technical things and kind of fun to work on, because there's a lot of things have to be carried or planned out. How are you going to carry a 200-pound guy plus all their crap to wherever they need to go and do it safely for everybody? I mean, a couple things to think about. You have to constantly be monitoring that person you're carrying. Any medical intervention you do is probably going to loose. Tourniquets and stuff that get placed start to slip. Bandages especially. You have to make sure that the way you're carrying them, they're not choking on their own tongue. So you have to constantly be monitoring that person. Thanks for joining us here at Outpost 95 as we went over the phases of care in TacMed. If you found anything that's valuable, please like and subscribe. God bless.